Anne Rimoin. She's a professor at the UCLA Fielding School of Public Health. Anne, good to have you.
Thanks for having me.
So first question, I guess, is the simplest one. I mean, are authorities confident that the outbreak is confined to this ship? Because I know they're doing contact tracing, including 88 people on a flight that one of the victims took. I mean, is it possible this is bigger than that ship?
Well, of course it could be bigger than what's on the ship. We don't know yet, and this is the very early stages of the investigation. You know, we have to start with what we know. And what we know at this point is that we've had an outbreak that seems to be connected to people that were infected, likely in Argentina, while doing bird watching or some other activities. This is these are the basic data right now, and we know that there was that there are now other people that have sick on a ship. There are other people that have disembarked from that ship and taken other modes of transportation. And that's why this is going to be very complicated. You know, this is going to be something that is a zoonotic transmission that now is potentially spreading from person to person. We assume that it will be through prolonged contact, but we don't have all the information yet. So we still are in the data gathering point. It's just going to be really complicated because it is involving lots of different countries and lots of different modes of transportation at this point.
This is bringing back, for me at least, some memories of the coronavirus outbreak. You know, questions about where it came initially, whether it was from animals, and then, of course, the virus mutates and potentially becomes more communicable. Are there similar worries about this one, that as it goes from one host to another, that it might become more likely to spread more widely?
Well, I think at this point, it seems like a unique situation and a set of circumstances where spillover from animal to human resulted in some spread. But at this point, you know, we don't know. What I will say is that hantaviruses are very different from coronaviruses and don't seem to spread as easily from person to person. And there's been very little evidence in the past of very sustained transmission from person to person. But we're in the early stages of this. We need to understand a lot more based on the data that's forthcoming. And here's the good news. The good news is that we have a lot of coordination between countries. This appears to be reasonably contained to people that had close contact to those individuals who were initially infected on the ship. And so it appears to be a low risk situation at this point, but low risk to the public does not mean low consequence for those people involved.
No question. And those people confined to quarters, right, in effect, for so long. I mean, is there any reason why the countries now on the list to take this ship in wouldn't want to take this ship in? I mean, they have understandable questions.
Well, you need to have good public health infrastructure and the kind of diagnostics available and the medical facilities available to be able to manage it. And that is something that is complicated under any circumstance. Health departments globally are always under stress and under high demand and relatively low resource. So it is going to be a complex and complicated investigation. And so I think that except the ship is going to make sure that they have all of these things in place.
Anne Rimoin, we appreciate you walking us through it.